Hey guys, we're from the Novus Center, and we're going to be talking to you guys about horror stories our patients have told us personally of treatments that they received elsewhere for Peyronie's disease and erectile dysfunction.
So guys, I wanted to tell actually two different stories from two different patients who I personally brought on to care. One was a guy who had done treatment at a facility in Central California, and after one treatment gave us a call. And when I was on the telephone with him, he confided in me that he was literally the very first treatment that this doctor had done. Apparently the doctor had bought a device to do acoustic wave for erectile dysfunction, and along the way he discovered that he was patient 0. Another story is a patient in Northern California who had done 24 treatments with another facility and was not seeing the results that he was looking for. He ended up coming down here once a week for a period of about 6 weeks or so, and during his time with us, saw amazing results. So you may ask yourself, why did 24 treatments somewhere else not work as well as 6 treatments did with us? At the end of the day, not all treatments are created equal. There are variables between the provider administering the care, the variables on the device itself, all these things play into it. So having an experienced provider knowing what to do has a huge impact on the speed of the treatment working as well as just the treatment overall.
One of my stories is a guy that came in for help after having a penile implant pump. What a penile implant is, you have to undergo surgery, which means that you're removing all this healthy tissue, replacing it with that device. When you remove healthy tissue, you're risking of losing lack of sensitivity and lack of blood flow, which basically means because in regular tissues, we have blood vessels that create optimal blood flow, especially in your penis, to get hard, firm erections. It also has nerves, which is gonna give you all the sensation that you need. When this guy went into surgery, he didn't technically know all of the risks that he may have after surgery. One of the big things that he was complaining about when he came into a clinic was that he wasn't enjoying sex anymore. He said having sex with his wife just feels like a chore. He was getting erections even when he didn't even want to get erections because the penile implant pump is a permanent erection 24/7. So when he tells me this, he's thinking of getting 6 treatments with us. Upon assessment, I couldn't feel any healthy tissue. At this point, there was nothing that we can do. The moral of the story is to consider all your options. Get a second opinion, because getting surgery, it's irreversible and permanent.
One last story that comes to mind that is pretty devastating, for lack of a better word, is there was a patient who had Peyronie's, who had done a number of injection Xiaflex treatments somewhere else, achieved some level of success with it, but still wasn't enough, so he eventually found us. And upon his initial consultation, he confided in us that he not only lost size, he lost over 3 inches in his overall length permanently, from what he's telling us, from these repeated injections. And it didn't solve the problem that he still had. So just keep in mind, guys, again, if you're thinking about doing something, there can be risks. There can be risks that are not reversible. And most guys pride themselves. We measure up, so to speak, with other guys, and losing 3 inches off of what you got is something I don't know any man who would be willing to accept.
Before receiving treatment for erectile dysfunction and Peyronie's disease, please get a second opinion. If you have any questions, feel free to reach out to us on our website, or feel free to post your questions in the comments below.